we'll charge on forward. I'm going to hit the record on this to see if we can get a recording of this whole thing. But we will head on forward. So first of all, who am I? I'm James. I was a traveling physical therapist with my wife, Kate, for about 10 years. We both started out in New England. My first assignment was back that way in the Boston area, in a little community hospital in Lowell, Massachusetts. And then we started traveling out to Colorado, and pretty soon we fell into a pattern of going to Aspen in the winters and working at the hospital here. And then in the summertime, we'd either go back to New England and work there for a while, or we would go to Hawaii a few times, or we went to Alaska once. So we got around a bit in those 10 years. But now we've had a kid and we're settled here in Aspen. We've been working here coming up on about a year and a half. So we're not travelers anymore, but still we were in the industry for about 10 years. So I think we're still continuing to share as much information as we can with people looking to get into traveling therapy. I do run a web page, hobohealth.com, and there's a bunch of blogs there. I haven't written anything in recent months, but there's still a lot of old information there, and I'll kind of show that website later and where you guys might be able to go for some good information. So this presentation is pretty short. I should be able to get through this in about 10 or 15 minutes, and then we'll just go into questions. And I'll try to keep it brief and just so we can know what you guys want to know. So what is traveling PT for anybody who doesn't really know what it is? It's just working temporarily as a PT or PTA. Typically, a contract length is 13 weeks, which comes out to 3 months. And it can be done close to home or far away from home. And what I mean by saying that is just basically what I said at the beginning, that I started out around the Boston area, which was home, which was where I was living, just because it was convenient. It was a way to get my feet wet and start working and travel without going anywhere. And then when the timing was right, Kate and I came out here to Colorado together. And Lauren, I'm fine. If kind of questions come up along the way, I'm fine fielding them whenever. If you just want to type in there, I'll try to keep an eye on that chat box. So why to do traveling physical therapy? I personally think the best reason is to travel. That was why I always did it, was to go work and see some different places, to work in some different settings and see inpatient, which I initially never really had any interest in. I was an outpatient ortho guy and wanted to do sports and ortho, and I think I was pretty narrow-minded about that now, looking back at all that I did end up seeing as a traveler, whether it be small community hospitals or bigger city hospitals, various rehab settings, a lot of home care as well. So I think it's a great way to just see different stuff. And where I say explore job opportunities, I think, again, I mean kind of picking an area, whether that be close to home or somewhere. You could just go do a couple travel assignments to kind of check out some facilities in your area and see what kind of opportunities are out there, rather than just having to jump full into a permanent job when the time comes for that. I put the worst reason is money. Traveling PTs do make more money, but I think that doing it just for that reason is probably a bad idea. The way that you really make more money through travel PT is through the tax-free benefits. And the three major forms that come in are per diem, which is an amount of money that's determined by the IRS depending on where you're going, that the company is allowed to give you tax-free for meals and costs and that sort of thing. The housing stipend is basically you can take housing from a company, or you can find it on your own. And if you find it on your own, you generally make more money because there's, again, this amount of money determined by the IRS that the company is allowed to give you tax-free for that housing. And a lot of times if you shop around, that amount of money is higher than you're going to end up paying for rent. So it's just a few $100 of tax-free money in your pocket. And then reimbursements, and that's just finding ways to get reimbursement for your licensure fees, for some of your travel costs and moving costs to get to wherever you're going. Little things like that can add up. And like I said, the maximums on all these numbers are set by the IRS depending on where you're traveling to. What is essential, though, to get those tax benefits is having a tax home. And ideally, to establish a tax home, you want to make sure that you have everything you can established at that address. Ideally, it's a place that you have that you're paying money to. Some people do rent a room from their parents, but if the IRS came auditing you, you would need to show that you had been paying them fair market rent for that place. Other people go to states without income tax and buy a small apartment. That's cheap and it's a place that they can call home, and other people have something established already that they can just continue forward with. But if you don't have a place that is a home that you are putting some money into, then technically you don't have a tax home. And I think a lot of recruiters and agencies would have you believe that the requirements are less stringent than that, to try to get you to take some jobs, and they'd give you the tax-free money, but it's really on you when the IRS comes knocking, whether you've played by their rules or not. So things that you can do at an address to kind of establish, other than just, putting the money in like we've talked about, but that can establish that you live there, or having your car registration there, having your driver's license there, voting there, having a bank in the neighborhood, having a membership on a club there. There's a bunch of different things, but again, if the IRS comes looking, it needs to appear, or it needs to be, that you have a permanent address there, that you actually live there and you are just living away from home working for a little while. And we can revisit that if we do some questions later, if there are any questions about that. So how to start. Sorry, I have some other windows open here blocking it. I'm not sure if you see those video windows or not like I do, but the first thing you want to do is contact some recruiters, and I'll use recruiters and agencies interchangeably there, because basically a recruiter is your representative from an agency. What you want to do is tell them where you want to go, what settings you might be willing to work in, and when you would be ready to start. Typically, I find with a lot of traveling jobs that between 2 and 4 weeks out from when you want to start working is usually when the jobs start showing up. Because very frequently, if a company is looking for a PT to work for them temporarily, something has happened recently, or something is happening fast, where someone has quit and found another job, or someone has been fired, or someone is going to be leaving on maternity leave, or someone has fallen ill for a while. Things like that they're going to be looking for someone to get started as soon as they can. So frequently when I was looking for contracts, I'd be looking a couple months out, but I wouldn't find one until basically 2 to 4 weeks before the job started. So after you've given your recruiter that kind of information about yourself, they'll go looking for jobs for you, and they'll come back with some options. Some of the bigger companies have big databases where they just have huge, large lists of potential jobs out there. Other agencies will actually call around to clinics and find potential jobs that match what you're looking for. So after that, once they presented you jobs and you've said either yay or nay to the potential of a job, then you can do an interview with a facility to ask them some questions. So basically, they're going to be interviewing you, but you're going to be interviewing them as well. Hello, guys. How are you?
This is a group.
Look at this room. Hi, everybody. So at that time, you would arrange a phone interview with the facility, and it'd be their chance to ask you questions and your chance to ask them questions. And I believe I talk about that a little bit later on in the next slide. But at that point, if the interview went well, then you get a job offer from the recruiter, and that's when you would negotiate the details of the contract. And that's when we're going back to some of those tax-free monies, talking about negotiating a per diem, a housing stipend, your hourly pay, and all of that stuff, starting date. And also any days you might need off, because the expectation is you're a traveler, you're there to work, they're in trouble with their staffing, and they want you to be able to show up, hit the ground running, and start seeing patients on one of those first couple days. So I think it's important up front when you're having that interview to ask about weekends and the time off that you may want. If you know you're going to a wedding or something halfway through that contract, I think it's important to have that on the front end, because they expect you to pretty much be there for most of that contract. If you are going to take vacations or time off, then you can take that in between contracts, and you can take as much time off as you want. There's nothing really to restrict you from going away for a month between contracts. So other things that I think are important to ask on the interview is asking about productivity expectations. You know, how many patients they expect you to see an hour or per day. I think that tells you a lot about the clinic. I always like to ask about my coworkers and the other clinical staff that may be working there, whether you're working with 4 PTAs per PT or 1 PTA per PT or none at all, whether there's athletic trainers in there supplementing your care or who else you may be working with, because I think that also helps paint a good picture of what the clinic looks like, because you're never going to lay eyes on this place before you work there. So you're just trying to get an idea of your mind of what a day at work there will look like. And then the one I always put at the bottom is who your supervisor is, who owns or supervises therapy delivery in that place. And the reason I put this one in particular is that really what you're trying to do on the interview is you're trying to suss out whether you're going into a good situation or a bad situation. And you want to try to avoid those bad contracts, obviously, which I don't really think there are a lot of. I did about 30 contracts, and there was really only one that was really bad that we had to terminate. And that's why I say who is a supervisor or owner, because it turns out the owner of the practice was an unlicensed chiropractor from South Africa. And I don't know if I had asked if they would have presented it that way to me, but I think some red flags would have gone up if I had asked that question on the front end. And I maybe would have looked a little bit more into the practice before I started working there. So I think the takeaway on this slide is ask enough questions to know, to feel like you're going into a good situation and try to avoid those bad contracts. But also, I don't think the bad contracts are all that often. At least that was not my experience. Licensure. This is the PT Compact, which is really changing the way people will be able to do traveling therapy. Previously, there was basically to go in between any state, you'd have to send for a verification of any licenses you held or have ever held. So in my case, where I'd worked in 7 different states by the time it was done, every time I wanted to go to a new state, I'd have to send letters all over the country asking for verification. And it became a process which really took a long time, up to 4 months or so to get all that paperwork in place for a new state. But now with the compact, as it develops, all these states in green here, you're basically for just a fee and a little bit of paperwork, you're going to be able to travel between those states and work in those states if your permanent home exists in one of those states. So Colorado is one of those states. So I imagine many of you have permanent homes here in Colorado. But let's say you came to Colorado from Wyoming for school, and you get your initial license in Colorado, you still won't be able to travel to those other states if your permanent home remains in Wyoming. So we kind of go back to that definition of tax home. It's very much the same for home state, that you need to be established in one of these green states in order to take part in the compact. I think the other thing to point out is that, there's 21 states now, and we expect there to be a lot more in the coming years. I think gradually over time, you'll see all of the states sign on, but that might take 15 or 20 years. We really don't know what kind of timeline that'll be on, but over the next few years, we should add, I'd say at least 5 states per year. Seems to be a reasonable expectation. Let me go to something else here, and you guys may have to coach me through Zoom a little bit. I just want to click on over to the current states that are issuing compact privileges. Can you guys?
James, the current states issuing are 3: Missouri and Oregon and one other. Colorado ideally will start on January 1st. The
Fantastic.
rules are being written as we speak.
Thank you, Cameron. And can you guys see this map I have up?
Yes, we can.
I'm sorry, the one from the compact website, the blue states, all the blue states.
No, we cannot.
Okay. Well, anyways, there's another. I'll go back over to PowerPoint in a second here on my computer. But there are, Cameron, it's Tennessee, Mississippi, Missouri, North Dakota, and Oregon is what I have pulled up on the compact website right now that are actively issuing privileges. But like Cameron said, us and others should be coming around soon. Do you guys see PowerPoint on your screen right now, or what do you see?
Yes, we see the PowerPoint.
Okay, let me put that back on my screen. All right. We're almost done with this talk, and then we can get down to the question and answer, because I'm sure that will be more valuable for you guys than me just droning on. Oh, great. We're at the end of it. So here, oh, and I wanted to, I'm supposed to tell you guys about those pictures on there, and it would be a nice independent touch and all that, but it didn't happen. I forgot. But here, here's my wife, Kate, and I. This was our first winter in Aspen about 12 years ago up on Aspen Highlands, and we never looked back. We love this place. I just say if you have an interest in travel PT, pursue it. There's very little to lose. If you try it out and you don't really like it, that's only 13 weeks. I really say you can do any job for 13 weeks. You can make it through, and if it's not what you want to do, then you go back to plan A and get a permanent job in a place that you want to be in. I think for success, and we can talk about this more if you want, I think enter with some professional experience. Try to get some clinical experience as a professional before you go into traveling. I worked for about 5 or 6 months in a private practice, and I think those first 6 months of practice shape you so much. You learn so much because unlike your clinical rotations, it's the first time that you're treating without a parachute, that you don't have someone who's responsible for your care. It's all on you and on your shoulders. So I think if you can get a little bit of experience and then go into travel, I think you're going to have a much better time traveling because you'll be able to pick the jobs you want and have a better shot at having a better clinical experience. Also, ask good questions on the interviews. Try to get a good idea of what that clinic looks like and what daily life in there looks like. But otherwise, it's just awesome. It's great to go different places and get to live in communities and be a part of those communities and really get to know people in a lot of different places and see the way PT is delivered differently in different states, in different settings. I just think it's a fantastic opportunity. And if you have an interest in traveling PT, I say go for it. I think that's it. Let's do some questions and stuff, because I'm sure that'll be more interesting than me just continuing to talk.
Okay, cool. So what we can do is we can just pass around my phone for anybody who has questions. But then we're just going to hear them through here. Right? Yeah. So who has questions?
This is so weird. Can you talk a little bit about the recruitment process? Like, do they send you a group? Sorry, there's a delay, so I'm just like thrown off by it. They send you like a list, and you kind of look through them and then choose which sounds good, or do they send you one at a time? Like, how often do they send them to you?
Yeah, your recruiter, when you talk to the recruiter, they're going to have an idea. You're going to tell them where you want to go, and they're going to have an idea of what the market is like in that area, whether there's a lot of jobs available or there's not a lot. You know, you may say, I want to go to, I'm just going to use Boston because that's home for me. So I want to go to Boston, Massachusetts, and they're going to tell you, and you're going to tell them, I want to work in outpatient physical therapy. And they're going to say, there are no private practice outpatient jobs in Boston, James. There's two outside of Boston by 2 hours. Would you want to go there? Or or we have a job that's half outpatient, half inpatient at a hospital in Boston. Or, you know, there's going to be a dialogue. It's not going to be just a written list of, we have all these jobs in Boston. Which one do you want to interview for? It'll be a back and forth, and the more flexible you can be about what setting you want to be in or where you're willing to go, then the better it's going to go for you. You know, since my wife and I were traveling together, what we would typically do is pick a place that was kind of central to where we wanted to be, and then we draw a little radius around it of an hour commute and kind of look for something within an hour commute of that area, and it would open up some possibilities to it. So it's not going to be a thing where they're just sending you a list of these are the jobs we have, because a lot of companies, they'll send you a list of those jobs, but by the time you get in touch with them, they have other interviews set up, or the job's changed, or it's gone away. But they'll call you and they'll say, okay, we found that outpatient job 30 minutes outside of Boston. Would you like to interview for it? And I say always interview, because if you don't like it, you can always walk away. If there's no other options, then you need to take what you can get. Is that a comprehensive answer to that?
Hold on, we got a little more.
Mm-hmm.
Yeah, that pretty much answered it. I just wasn't sure if there's like some such thing as being like too picky, where if they send you something and it's not what you're looking for, will they like continue to keep sending you things basically?
Yeah. Yeah. I mean, you should, when you find a recruiter, I asked a while back how many, I ended up on an interview for, Jayco was interviewing my staffing agency, to accredit them. And I ended up talking with the Jayco auditor, and I asked them how many staffing agencies there were in the US. And they said at that time, and this was a while ago, I bet there's more now, they said there were 300. So point being, be picky in who you choose for your recruiter. You should get along with them. You should be having conversations with them. It should be a dialogue that goes on. It shouldn't be a relationship where they just send you a job every 2 months or something that maybe fits your criteria. And I know there are a lot of agencies, especially the larger ones, that operate it that way. I don't think I answered your question, and I've forgotten it at this point.
No, you totally did. I actually was wondering, do you have one recruiter at a time? Like there are 300 agencies.
Yeah, I usually went with 3.
Okay.
Some people do choose to go with one recruiter at a time, just because it's more simple and if there's someone you trust and all of that. But I went with 3 because you can kind of shop around a little bit and see not all agencies are going to have the same jobs. There are some jobs that will come through every agency because they're on a big database, but other jobs will just show up with one agency and then another job will show up with another. So I like the variety of having 2 or 3. But with that said, my wife and I were looking with, I think, 6 agencies at the beginning, and that got pretty sloppy, just because different agencies would start approaching jobs and saying, hey, I got this couple that wants to go travel. And before you know it, there were 3 agencies offering us all to the same job, and it got tough. So I like 2 to 3.
Cool. Thank you.
No problem.
I'm curious about healthcare and benefits, especially if you're kind of shopping with multiple agencies. How did you guys just buy your own and then manage that on your own? I know some will offer benefits as part of the package, and I don't know what the requirements are, like how much you're working, all that. If whatever insight you have would be great.
Yeah, it's if you're just doing typical 13-week contracts through agencies, it's pretty clean cut and dry to just get health insurance through them. And it does mean if you are working with 2 or 3 agencies, it gets a little bit more complicated just because you're having to do a lot of paperwork to establish your healthcare at the beginning of each contract every 3 months. But so if you do it that way through agencies, it's a great way to go. The benefits are great. They give you healthcare and usually life, and maybe if you do 2 contracts in a row with the same company, they'll offer you 401k, and the benefits tend to build that way, where the longer you stay with an agency, the more they offer you. But we ended up getting our own health insurance because we started doing independent contracts with clinics. So basically there were a couple times, I'm trying to think of the first place we went. It was probably Alaska that we went to, and we weren't finding any jobs around Anchorage. And we had a friend who was a PT living in the area. He started calling around to people, and we started calling around and got some independent contracts there where basically the clinic just said, okay, we're paying you this much per week for 40 hours per week. And we had to go get our own insurance. So then I did carry my own insurance for quite a while. Through United, just through a broker. This was before the health exchanges, but I think the health exchanges would probably help that process now. But my wife was doing short-term insurance, which is an option too, where you would get an insurance for 6 months at a time, and then we'd go back and we'd work for an agency. So then we'd be all set for 3 or 6 months or whatever. And then we'd be back off doing an independent contract, and she'd get another 6 months of short-term coverage. And what I did during that time, because I had my own coverage all through that, even though we were kind of bouncing back and forth between agencies and independent contracts, is I was always ask the agency for another $1 an hour or something like that, since they didn't have to give me health insurance. And so that was a nice thing to ask for. Sorry, long answer to what should have been a simple question.
No, good insight.
So you said that you and your wife do travel PT together. How accommodating have you found the travel agencies to be for like the both of you to stay like maybe the same site or like within the same region? Has that been an additional challenge for you guys?
It is, but not greatly so. We were always able to find 2 contracts in relatively the same area. And I think that's been the experience I've heard from other couples that travel to, whether they be 2 PTs or a PT and OT or PT and speech or whatever. For the most part, it went pretty smoothly. There's a lot. I think one of the hard parts for us was we were always looking to go to the same place, but to try not to work together. And more often than not, the recruiters would come back with a hospital who was looking for 2 PTs. So we ended up working together in the same clinic a lot more than we had intended to, which was fine. But, I think there were a few times when we really wanted to go places like Alaska, one time on the Big Island in Hawaii. We got one contract, one agency job, and then one of us had to find an independent job. We just said, okay, we're going, and then started calling clinics and seeing if anybody needed help for a few months. But it always seemed to work out.
Anybody else questions?
So you gave a lot of good tips about interviewing for jobs. Do you have some more tips or red flags to look for with like recruiters and agencies? Because I've already found just talking to people, they can be kind of aggressive.
Yeah.
Get you. So
Yeah.
anything there.
Yeah. I don't know. Yeah, I don't know how you figure that out off the front end. What I've just kind of gone with is, or what I tell people is, you got to like the recruiter you're working with. If you get a bad feeling about them or you don't feel like they're giving you enough attention, and that's probably a good instinct to follow. And there's plenty of other agencies out there to go with. I think the other important thing to remember is that you, the PT, are the commodity. Nobody's making any money if they don't find you a job and get you working. I think some of the agencies can make you feel like they're doing you a favor by getting you this interview in the city you want to be in a setting you don't want to be in, and they're not getting paid if you're not getting the job and getting paid. So I would just put yourself first, and if you don't feel like you're being served like you should, then you're probably right. I hope that helps. I know that's not a real firm answer, but I think I like the medium and small size agencies a lot better. The ones that you hear about a lot tend to be a little more corporate and not necessarily have the same goals as you do as the healthcare provider.
Great. Does anybody else have any questions?
Could you speak a little bit about mentorship?
Yeah.
Specifically, I know you said that it's a good idea to wait a little bit. I don't know. Did you find that you had a mentorship through the companies at all?
I know some of the companies are starting mentorship programs or have in the last couple of years. I don't know. Sadly, I think what you're going to see with that is that they hook you up with somebody who's going to be able to talk to you about travel PT, but may not be a great mentor clinically and might not really be growing you professionally, but they might be able to handhold you through the traveling process, which I think is great. I think that's important. I think it's a nice thing to do, but it's probably not what you're referring to as much. What I did was I had graduated just with my master's kind of right as the transition was happening. So I pretty quickly got into a doctorate program and started having that structured learning. And that helped me a lot to grow and keep learning and keep moving forward. And then after that was done, after a couple of years, then I started studying for my OCS, and that was good. And that kept me going for a couple of years. But then I would say I hit a lull, and it's really easy when you're switching jobs all the time and you don't have a formal track. It's easy to lose track of it all, and suddenly a year's gone by and you haven't taken a continuing education course or anything. So I think it's important to have some sort of structured path forward, whether that be planning to study for some sort of specialty, or maybe things I know are in the manual therapy world. So maybe you want to get like a Mulligan certification or McKenzie or something like that, something where you're going to classes routinely moving forward. There's distance residencies and fellowships that you can do mostly online. I know travelers that have, the rare traveler that's done something like that. But on the other hand, while you might not be traveling forward in any one specific direction without choosing to do that, I learned so much as a traveler that I never would have touched. Just oncology, wound care. I mean, just working in acute versus working in outpatient, you learn a totally different side of ortho and things like that. So there are advantages professionally growing of doing travel and working in a bunch of different settings and seeing all that stuff. But as far as a formal path, I think you've kind of got to chart it for yourself.
That's great. Thank you. Another question is, if you wanted to work in some of the more, like some of the smaller kind of sections of PT, like pediatrics, is there an option to like just stay in one field, or do you have to just be open to all experiences?
I think the more flexible you can be, the better. The easier it's going to be to find a job. But there are people who travel in peds, and there's companies that staff school positions. I had a PT friend who's married to a speech therapist, and for 2 or 3 years, she just went from school contract to school contract to school contract. So they would stay somewhere for 9 months. She'd work that contract and then go on somewhere else. There's opportunities out there in all kinds of different settings. You may have to search a little bit more for them, but they're out there.
This is more of like a clarification, but for the housing situation, did you say that you have to have a mortgage somewhere? So like, for example, I moved here from New York for school. And so I have like an apartment and I'm registered to vote and I have a license here. Would that be enough to count as my sort of like home state? Yeah, taxes.
If you maintain an actual place here in Colorado.
Even though it's like rented and not mine, that's okay. If
you rent it, that's fine. If you continue to rent it while you travel.
Got it. Okay, great.
So, and I think, what did they say? I'm kind of just quoting things from a tax guy that I worked with for a bunch of years. And he said, he's basically like, if you have a room somewhere, if you're paying someone money for just a bedroom, like that'll do the trick. But it does have to be fair market, and you have to be able to prove that it's there waiting for you, because an auditor will like go to that space and say, hey, is any of your stuff here? Do you really live here? If you got into a serious audit.
Got it. Okay, great.
Okay, James, this is Kiki.
Hey, what's happening?
Hi. I don't think we have any questions, so I think Lauren might want to wrap up.
Here, let me flip through
say
here.
Thank you for doing this.
No problem.
Sorry.
Nope, you're okay. I was just looking at some other stuff, seeing if there's anything else I wanted to touch on. No, I'm good.
Okay, great. Thank you for doing this. Sorry about the audio and the video. Thought it was a little complicated, but everybody really enjoyed it. There are, let's see, try and get the video back up so that you can see. Where's it? Oh, yeah. There's 30 of us. Oh,
hi, guys.
There you go.
Thanks for coming. It's exciting. I'm always happy to talk about travel PT. So thanks for showing up and listening.
Yeah, thank you very much. And we'll touch base later on. Thank you.
Okay, cool. Hey, here's, you still there? Here's, this is the website. It has blogs on like all these things you guys asked about, hobohealth.com, hop on there. Like I was just basically quoting all my blogs from the past. And if anybody has any questions, I'm at james.spencer.pt@gmail.com.
Great. Thank you very much.
Cool. No problem. Have a good day.